I think there's a stereotype that somebody autistic would never use drugs because of this view of really rule following. I certainly am. We're really kind of a rule follower to a fault. I'm Millie. I am 38 and I'm living just outside of Victoria, actually, in Colwood. For the last few years, I've been a harm reduction worker and peer support worker. Being an autistic person who uses drugs, because of autism, I'm hypersensitive to a lot of things and hyposensitive, less sensitive to others, but especially with hypersensitivity, I'm just so overwhelmed all the time. And that fed into a lot of extreme anxiety and stuff. Once I found things like opioids, like Oxycontin and heroin, that kind of thing, those things became my drugs of choice. I experimented with a lot of things to try and find what worked, but that was the first thing that really seemed like medicine and calm down my nervous system. That works better to me than a lot of the more quote unquote legit medications that have been prescribed over the years. And those other psychiatric medications had more side effects. I just really felt like I was just in extreme discomfort all the time that I couldn't cope with. I would go to group things and parties and stuff like that. And that to me is a nightmare. Sober, first with drinking and other things, it's like I could cope with these things, I could fit in a way. It was like fitting in based on something that wasn't really truly me, because I felt that alienation like from when I was really little already. So I was always trying to camouflage and mask and all these things. I think substances really allowed me to do that. The other reason is for escapism from trauma and perseverating and ruminating thoughts. I have PTSD as well, so I have very clear and vivid long-term memory. So I can unfortunately remember those things in a very clear and real way and go back to those traumatic experiences in my head. And opioids especially help with that. It really helps me a lot with sleep and nightmares. It's not, the solution is to have people go do drugs. I work in a field where we want to have people be able to use substances safely. I wish I could have learned other coping skills and been more true to myself in a social setting. Like I've dealt with my whole life of just having times where, even though I'm very articulate right now, I just completely lose my ability to speak. I didn't know why. I wasn't getting that help from people that I needed. And the messaging anyways was that things were just my fault. And it just also gave me the sense of then not even trying to ask for help. I just kind of was using drugs to kind of help myself in the moment in any way that I could. Harm reduction can mean so many things. People do things that can cause them harm, and it's literally just not asking them to stop completely, just making it so it causes them less harm. And in this context, I work in substance use, addiction, drug use kind of harm reduction, giving out harm reduction supplies like needles, condoms, gear for smoking drugs. I've done naloxone trainings in the past to reverse overdoses. I'm also a peer, so because of my substance use and mental health history, being neurodivergent, so I'm a peer of those things because a lot of the people I work with experience those things. When people access a service, they have somebody there who can directly empathize with them a bit more so they feel safe and comfortable. If you ended up in this place, there's a story there and a reason why you end up here. And once you know that story and the reasons, it's probably going to go a long way to help you get out of that cycle, or at least if you're kind of in this cycle like I am right now, just to be more accepting of myself, and that person would be hopefully then more accepting of themselves as well. As I did seek out people who have your experiences, probably what they're thinking is that they're a bad person and it's all their fault. That was my experience. And I hear that so many people from had similar experiences, right? They just beat themselves up and it just destroys their self-esteem. But if you can seek out people who've gone through similar things like yourself, you might, like I did, just get explanations of why these things happened and try to remember everything has a reason behind it.